washed in a specific way that is applicable. What is done by the scientist is estimated 1 gram, or about weight of 100 to 120 kilogram weight of human body, should be about the right size. Don't forget, this is the information we are giving to the scientific world. This is why they're called the blueprints. We are sharing knowledge with the scientific organizations who come and see. We've seen a huge download and interest by many research centers in this development because the results are fairly rapid. It can be tested. The injection system was not strong enough because of the amount of the gas which was used. So we have abandoned the injection system because of the lack of the material strength, but we're still following the process to see how it goes and how the development goes. I do apologize, I have a very bad cold for the past week or so. So how does this work? How does the GANs, we explain to the scientists who have joined us to understand the process. Go back, if you have not been with us, to the origin of teaching, what we saw with Dr. Rodriguez. Dr. Rodriguez, at the beginning of the blueprint, explained to you something very simple. If you've been around the Keshe Foundation, you understand. Where he had the breast cancer, he placed 2 patches on either side of the breast. Or that's what's recommended. If you have a cancer, with 2 patches on either side where the cancer sits in the middle. There is a ratio difference depending on the doctors what they do between the 2 sides. This is the back, spinal cord, and this is the front. Ratio 2:1 or 3:1 is recommended. Where there is a gradient in the flux flow between the 2 plates with the cancer in between. As is the habit of the plasmatic field, the strongest tries to bring the weakest back to balance, and in that process, they deplete gravitational magnetic field from the tumor. If this understood, and we've seen the results with the breast cancer and other cancers, now what we have shown as the process with the GANs is very dramatically not far different. This is why we brought the teaching of today. This is for the doctors and scientists and general public to understand. When you know, when you understand a knowledge, you don't need to remember, you have to follow. Once you understood the use of the 2 patches, now becomes very simple. You have the body of the man. We have introduced into this body a new patch. The breast is still there. All the organs are there. The new patch is a total length of from mouth to anus. When you go through consuming plasma GANs, or now that the doctors start research with the animal, now going to the humans, this is what's happening now. You have transferred the patches outside into the patches that continues inside. This is the beauty with this technology. This is the beauty of the application of when you use GANs, plasma GANs in digestion. So when you use any kind of material with the plasma, with GANs. Now you understand all you need to do just to put the patches where you like. Because the field strength in the body when you consume GANs is not just going through the intestine, it's creation of the new field controlled centrally. If cancer happened to be here, now you see you have a 3-to-1, 10-to-1. And then all you need to do is very simple. Wash the body of the man with CO2. GANs plasma. Now you see the process with the tumor becomes like this. So tumor can be anywhere in the body. With this process, we cover the totality. This is the beauty of it. This is the advancement in technology, understanding the total process. That's why we look and we are asking the world of science to test it. But the beauty with this technology, the way it's applied this way, is that cancer only spreads, in majority of the time, in the body of the man, from neck to the leg, to the hip. And with this process, you cover everything. Ovaries, liver, kidneys, anything you like. The lungs. So now you have a general path. And as we've seen from the reports from Tokyo, is totally non-toxic. So if you wash the body with a combination of liquid plasma GANs of CO2 and zinc oxide, make sure you have no material GANs on it, as many of you have done. Now you have made a full structure. You have made a full containment of the whole plasma, and you have to find the right strength that in totality any secondary cancer comes into the same ballgame. You can add patches in a given position for a given cancer to concentrate the